I wonder how much is for the part-time LPN program?
The cost of the part-time class is $32,000.
$32,000 for a part-time LPN program?
Claudia, veremos. So how are you feeling? What's going on?
Not good. I have this shortness of breath.
Do you have chest pain with that shortness of breath?
Yes, I do.
I'm going to help you get into the gurney, and I need you to change into this gown for me. Leave the opening in the back and all your undergarments on.
Other classic signs and symptoms of heart failure can be weight gain of 2 to 3 pounds over a short period of time, within 2 days period, shortness of breath, orthopnea, swelling of the ankles, feet, or abdomen, persistent cough, and frequent nighttime urination.
Breath out with some chest pain, more of a pressure.
Okay.
Hi, Claudia. This is Wendy. This is going to be your nurse. I have some questions for you.
Hi, Claudia. I hear you're having some chest pains today. You are? All right. Do you have a history of heart failure by any chance?
Yes, I'm diagnosed with HIV.
All right. Do you have pain in your chest?
Yes,
Is it sharp, dull? What kind of pain is it?
it's sharp.
Sharp? Do you have any pressure?
It's, yes, pressure and shortness of breath.
All right. The pain doesn't radiate anywhere?
Her pressure's pretty high. It's 180 over 72.
All right. Claudia, can I sit you up? I'm going to listen to you really quick, okay?
Heart rate's 102.
All right. Jody, can you give me an EKG, please?
Yes.
Claudia, I'm going to go ahead and start your IV while Jody goes to get the EKG machine for you, okay?
Claudia, your EKG and labs are back. I'm going to go get Dr. Rios. He's going to come in and give you your results. Okay? Hi, Dr. Rios. I have the labs have come back for bed 2, Miss Claudia.
Okay, what's going on?
And she came in with chest pain and shortness of breath.
Mm-hmm.
Everything has come back within normal range,
Right.
and the EKG is within normal range as well. It doesn't read MI. I mean, it's like normal sinus rhythm.
Okay.
So I'll leave that there for you, and I told her just a few minutes ago you'd be there soon, so,
Okay, tell her I'll be there in a minute.
so you might want to put that pie down and go see your patient.
All right.
Lab values that would be used as cardiac markers would be troponin, a normal level would be 0.04, and a critical abnormal level would be over 0.75. The CK-MB is less than 5. CK for a male is 55 to 170, and a female is from 30 to 136. The BNP is less than 100. Anything abnormal or critical would be over 100. The CMP level, you would note down the electrolytes. That would be your calcium. The normal value would be 8.2 to 10.4. Abnormal or critical would be less than 7 and over 12. The sodium level would be 135 to 146. Critical abnormal level would be less than 20 and over 155. And a potassium level, the normal value would be 3.7 to 5.9. And the abnormal level would be less than 3.0 and over 6.0. For the ESR, it would be 40 milliliters per hour in men and 45 millimeters per hour in women. The red blood count is from 3.9 to 6.3. The white blood count would be 9,000 to 30,000. For an abnormal level, it would be below 900 and over 40,000 to 70,000. And your hemoglobin would be 14.5 to 22.5.
Hello, Claudia. I'm Dr. Rios. Looked over all your labs, your EKGs. I didn't find anything abnormal. I think you are just experiencing a little bit of anxiety, maybe, or nervousness. Is there any reason you'd be experiencing that?
Yes, I went to see how much was the part-time LVN program, and it was $32,000.
Oh, that is understandable. You're most likely experiencing an anxiety attack, okay? I'm glad you paid attention to your signs and symptoms, but in the future, if you have any kind of chest pain, I want you to call 911 immediately, okay?
Okay.
Hey, good news, Claudia. I'm glad to hear everything came out okay. So I'm going to have you change back into your clothes, and the nurse will be back in with your discharge instructions, okay?
Okay,
Hope you feel better, and don't forget to call 911 next time you have chest pain. Don't drive yourself into the ER.
Okay, thank you so
All
much.
right, have a good day.
You too.
During discharge, you would teach your patient to maintain a low-fat diet with fat intake less than 30% of total calories. Take medications as prescribed. If several medications are prescribed, develop a method to facilitate accurate administration. When taking digoxin, check the pulse rate daily. Report a pulse rate less than 60 beats per minute to the physician. Do not take the digoxin if less than 60 beats per minute. Take diuretics as prescribed. Weigh yourself daily at the same time each day. Report signs and symptoms of hypotension, which is lightheadedness, rapid pulse, and syncope, to the physician. Avoid alcohol when taking the vasodilators. Reinforce the importance of regular exercise once heart failure is stabilized. Throughout treatment regimen may allow the patient to increase activity level over time. The physician may ultimately recommend 30 to 40 minutes of aerobic exercise to 3 to 4 times weekly to improve patient's well-being. Report to the physician for follow-ups appointments as directed.
Hi, Ms. Aravalos. Dr. Rios went ahead and gave me the okay to discharge you, so I'm just gonna give you some instructions really quick that he left for you, okay?
Okay.
He said that if you have any recurring symptoms, just like you did today, the shortness of breath or the chest pain, just go ahead and call 911. Don't try to drive yourself here, or else, you put yourself at danger and other people. Your medications, just take them as prescribed. When you go to the pharmacy, the pharmacist will explain them to you again, so that if you have any questions, you can also ask him, or go ahead and call Dr. Rios again.
Okay.
Okay, just rest a lot and try not to eat so much salt. Okay?
Okay.
All right. Well, it was nice meeting you.
Thank you so
Okay.
much for your help.
If the situation had resulted in heart failure, medications for the cardiac patient would have been cardiotonics. Cardiotonics increase efficiency and improve contractions of the heart muscles, which lead to improved blood flow to all tissues of the body. These drugs have long been used to treat heart failure, a condition in which the heart cannot pump enough blood to meet the tissue's needs of the body. Heart failure is a complex clinical syndrome that can result from any number of cardiac or metabolic disorders such as ischemic heart disease, hypertension, or hypothyroidism. Cardiotonic drugs are used for patients with a persistent symptoms, recurrent hospitalizations, or as indicated in conjunction with ACE inhibitors, loops, diuretics, and B blockers. Digoxin is the most commonly used cardiac drug. Cardiotonics, particularly digitalis drugs, increase cardiac output through positive inotropic activity, which is an increase in the force of the contraction. Digoxin's trade name is sometimes called Digitec, Linoxicaps, Linoxins. Its uses are for heart failure. Adverse reactions include headache, weakness, drowsiness, visual disturbances, nausea, vomiting, anorexia, arrhythmias. Dosage ranges are: the beginning low dose is 0.75 to 1.25 milligrams orally, or 0.6 to 1 milligram IV. Maintenance doses are 0.125 to 0.25 milligrams a day orally. Contraindications include digitalis toxicity, a term used to describe effects that occur when digoxin is given. Contraindications are indicated in the presence of digitalis toxicity in the patients with known hypersensitivity, ventricular failure, ventricular tachycardia, cardiac tamponade, restrictive cardiomyopathy, or AV block. Cardiotonics are also given cautiously to patients with potassium that are too low, hypokalemia or hypocalcemia, and magnesemia, thyroid disorders, severe garditis, heart block, myocardial infarctions, severe pulmonary disease, acute glomerulonephritis, and impaired renal or hepatic function. When the cardiotonics are taken with food, absorption is slowed, but amount is absorbed in the same. However, if taken with fiber, high fiber meals, absorption is decreased. Some drugs such as activated charcoal, which is an antidote to poisoning with certain toxic substances, actually decrease serum digitalis levels. However, interactions with macrolides, which are used to treat infections, actually increase serum digitalis levels, leading to toxicity. Another inotropic drug is malegnone, also called Primacor. This drug is used for short-term management of heart failure. Adverse reactions of this drug include ventricular arrhythmias, hypotension, anxiety, chest pain, headaches, and hypokalemia. The loading dose is 50 milligrams per kilogram in IV, up to 1.13 milligrams per kilogram per day thereafter. Signs of digitalis toxicity include gastrointestinal anorexia, usually the first sign, nausea, vomiting, and diarrhea, muscular weakness and lethargy, central nervous system, headache, drowsiness, visual disturbances, blurred vision, disturbance in yellow-green vision, a halo effect around dark objects, confusion, disorientation, and delirium. Cardiac changes in pulse, rate, or rhythm, electrocardiographic changes such as bradycardia, tachycardia, premature ventricular contractions. Hypokalemia is another major nursing alert to be cautious of because hypokalemia makes the heart muscle more sensitive to digitalis, thereby increasing the possibility of developing digitalis toxicity. At frequent intervals, the nurse must observe patient with hypokalemia closely for signs of digitalis toxicity. Digoxin-specific antidote is digoxin immune fab, also known as Digibind. This is an antidote for massive digoxin overdose. Adverse reactions of this drug include hypokalemia, reemergence of atrial fibrillation, or heart failure. Dosage ranges from IV dose, depends on serum digoxin levels or estimate of the amount of digoxin ingested. The average dose is up to 800 milligrams or 20 vials. Diet plans for patients with heart failure include avoiding antacids and non-prescription cough, cold, or allergy medications, antidiarrheal, and diet weight-reducing drugs, unless their use has been approved by the primary health care provider. Some of these drugs interfere with the action of the cardiogenic drugs or cause other potentially serious problems. Take your pulse before taking the drug and withhold the drug and notify the doctor if your pulse rate is less than 60 or more than 100 beats per minute. Offer frequent small meals rather than 3 large meals. Suggest restricting fluids at meals and avoiding fluids 1 hour before and after meals to help control nausea. Sodium restrictions in a patient with heart failure is a diet priority. A patient should know the salt content of almost every dietary food that they are exposed to. It is very vital that they understand how to read labels and canned food items, frozen food, snacks, sodas, and fast food. Examples of food high in salt are chicken broth, Chinese food, or other frozen dinners. Sodium restriction helps to limit fluid retention. Using herbs to add to flavor to foods or potassium or DASH diet is recommended. Lifestyle changes such as encouraging increased daily activities gradually as tolerated, increased adequate rest periods are planned during the day. Assist the patient with activities and ambulations as necessary.